penuh A53KJ 34809/2013 Nur Muhammad Nazrin bin Rano Sharifah Zuhira binti Said Tahir terhadap Gurjit Singh, Pira Singh, YAL Resources Holdings yang berhad. Saksi plaintiff pertama, Tuan. Dr.Kantha lelaki Rasalingam. Sila berdiri. Speak English. I, your name, full name, until true. Loud and clear.
I, Kantha Rasalingam, do solemnly, sincerely and truly declare and affirm that the evidence which I shall give in this case shall be the truth, the whole truth and nothing but the truth.
Okay, your name again?
Kantha lelaki Rasalingam.
Okay. Age?
41.
Residency address as per IC. What's your designation?
I'm a neurosurgeon at GH Scale.
Neurosurgeon?
At GH Scale.
Hospital Kuala Lumpur.
Tuan Hakim, boleh saya minta kerana doktor yang berjalan dahulu, bolehkah kita selepas ini ambil satu tarikh untuk doktor saya untuk datang? Satu tarikh lagi untuk doktor kami untuk datang ke mahkamah. Bolehkah kita minta satu tarikh lain untuk doktor kami untuk datang ke mahkamah untuk memberi keterangan? Bukan, saya tidak tahu bahawa doktor-doktor dipanggil hari ini dan report ini oleh Dr. Kantha semalam sahaja kami terima. Ya, tapi Tuan Hakim, kami terima report ini semalam.
Dia berkenaan yang sama kan? Tidak ada keterangan baru?
Tidak, tapi kita Tuan, is different. I have to show to my doctor, Tuan.
Okey. Ikatan kan ada?
Tak. Belum. Saya dah gabungkan semua dalam gabungan.
Sebab ada perubahan, Tuan. So now it's only Ikatan Pleading SA, gabungan S.
Ada dua ikatan lah.
Bagi plaintiff, Tuan. Manakala defendant ada bukan 3.
Kopi, Tuan.
So, ikatan politik ikatan dokumen,
Gabungan Ikatan Dokumen Plaintiff B, Tuan. And then can you show me first so that we can, before you supply the copy to court tomorrow.
Yeah. I can file a gabungan besok.
Okay. But this one will tender or not?
Yes, yes.
Okay, which one come first?
All. Look at the date.
The purple first or
Wait, let's look at the date first.
10 of August? I believe it's the 9 June first lah.
Yeah.
Ikatan Dokumen Defendant bertarikh 9 Jun. Ikatan Dokumen Defendant bertarikh 9 Jun 2014 SC ya. Ya kan? 9 Jun. Ikatan Dokumen Tambahan Defendant. Ikatan Dokumen Tambahan Defendant bertarikh 12 Ogos tahun ini sebagai D for Denmark. Ikatan Dokumen Tambahan Defendant 10 Oktober sebagai E for Elephant. Itu saja. That's all.
Kantha Rasalingam, could you please state your qualification and your...
qualifikasi ketika
Tidak.
Did you examine one Sharifah Zuhira binti Said and then prepare a specialist medical report pertaining to her condition?
Yes, I did.
Najib Wan Saiful duduk saksi pada ikatan B muka surat 49 hingga 53.
Ikatan B muka surat 49 hingga 53 49 hingga 53 Ikatan B gabungan.
Referring to your report, can you confirm this your report?
Yes, this is my report.
Only one number. P1 P1 kan? 49 hingga 53 tu. P1 tu. Defendant punya
Defendant.
Muka surat 2 ikatan E for England kan.
Perangan pertama tuan dirujuk. Refer to paragraph 1 of Dr. Yokohong Sukon. Where it stated that Sharifah should suffered a concussion of the spinal cord. Do you agree with this opinion?
No, I do not agree.
Sorry, page what?
2.
No, of the
England.
ikatan.
England.
E for England.
Your ikatan.
Could you give reasons why you disagree with that particular statement?
The statement says it is quite obvious that she belongs to a third group which suffered a concussion of the spinal cord. Concussion of the spinal cord is a term used for transient injury of the spinal cord. And in patients with transient injury of the spinal cord or concussion, the patient should recover within a period of 48 hours. So I do not think that this is a concussion. As the patient, when I examined her after a period of 2 years, is still having neurological deficit. So it can't be a concussion.
Terakhir saya tuan, saya ingin rujuk saksi pada ikatan B sekarang tuan. Surat 34 hingga muka surat 48.
34 kan hingga 48.
Ikatan B. I refer you to the report from PPUM by one Dr. Nazirah. My question is, what is your views on a particular report?
The report is prepared by Associate Prof from UM, who is a rehab specialist. I find that the report is consistent with the injuries of the patient. And I find that since she is a rehab specialist, the findings by her should be taken into account as she will be the right person to ascertain the methods of rehab for the patient.
Yes. Okay, Dr.Kantha, is it?
That's right.
Sorry, okay. You have read through all the other medical reports which has been presented to you before you examine Sharifah Zuhira, correct?
That's right.
Is it not true that the patient has improved on her mobility and her strength since the day she was bedridden. Now she has improved.
That's true.
Okay. Could you help us to find the place in the report where you said that you reported regarding her strength and her mobility?
Yes. Yes.
Okay. Which page is it?
51?
51.
That's right.
Tuan Hakim, saya merujuk kepada muka surat 51 Gabungan Ikatan Dokumen Plaintiff. Okay. What does it mean when you reported that things like biceps 4+/5? What does that mean?
That is a power grading, and that is how we grade the muscle powers. So if you say that if a grade of 4 is given, that means the patient is able to move against resistance. So that is 4. If it's 4+, that means the patient is able to move against greater resistance. And the normal power is 5/5.
I'm a layperson here. I
Sure.
want to know if 4+/5
Yes.
is good
Is
compared to a normal person. Is good 4+?
compared to normal? No.
Of course, is no. Sorry. How good is 4+? How good it is? Can you explain in terms that we can understand?
Okay. When a patient has got 4+, that means if you ask, when we assess the patient, we put resistance and the patient is able to push. So maybe if you want me to explain, 0 is no power. 1, when we assess, if the patient is not moving at all, is 0. If the patient flickers, is 1. If the patient is able to move on the bed, it's 2. If the patient is able to lift against gravity, is 3. That means they lift like this without resistance, is 3. If the patient is able to resist, is 4. And in 4, we have got 2 subgroups, which is 4 and 4+. So this patient, some of it is 4 and some of it is 4+.
Right. Tuan Hakim, could we just list down what he wrote down? Give me some time. Yeah. When you said 1 is no movement,
0 is no movement.
Movement. Oh, okay. Okay. Yes.
Later we go transcription.
Yeah, we will take a transcription later. Yes. Okay. Okay. So this person, when let's say for grasping something,
Yes.
okay, is she at 4+ now?
When we assess the muscles, the small muscle of the hand is 4+. So some of the muscles, because different part of the muscles are supplied by different nerve. So some of it is 4+ and some of it is 4.
Okay. Regarding movement of her legs,
Sure.
did you check that as well?
Yes, I did.
How much is the power? Is it 3? Is it 2?
It's 4.
It's 4.
Yes.
Okay. When a person has at the level of power at 4, would she need to be permanently on a wheelchair?
I am unable to answer that question.
Please explain.
When the patient has a power of 4, it means that the patient is not able to walk on their own. 4 is not full power. So I can't say, because if you ask wheelchair, they might be able to walk maybe with support, crutches, might be with wheelchair, so it's very difficult to determine that.
You have examined the patient and you find that she can take her own bath and she can feed herself?
From her history, she says she's able to eat on her own. She's able to take bath, but she's not able to. But her bath is only on the shower. She's unable to hold the pail and bathe.
Okay. She can shower. Okay. Read the previous reports. Can you specify what are the improvements she has made during the last 6 months? Because you've seen her now,
yes.
You've seen the previous reports. What improvements has she made during the last 6 months?
Last 6 months, I will have to look at the reports again. For my recollection, she was seen by Dr. Siva, and I think Dato' Yo, all within the last 6 months.
Yes.
It is quite difficult for me to comment because I have not seen her 6 months ago. So if you want me to look at the report, I can look at the report and mention to you.
Just give us the gist of her
Okay,
main improvements. Like, for instance, cannot walk and then now she can walk.
Okay, let's see. In motor power?
Yes.
Would I have a report of Dato' Yo for comparison? From Dato' Yo's report, I think dated 3rd of June 2014, page 2, I think Dato' Yo has examined her as well, and he has mentioned motor power was grade 4+ in the legs. So to your question, I think her power is about the same since last examination.
saya tiada soalan-soalan lagi bagi saksi itu. Terima kasih.
Saksi sosial adalah panggil Dr. Nazirah.
Can I have your seat, please?
Eyes.
Saksi Plaintiff kedua. Right hand. Full name until the truth, loud and clear.
I, Nazirah Hasnan, do solemnly, sincerely, and truly declare and affirm that the evidence which I shall give in this case shall be the truth, the whole truth, and nothing but the truth.
Okay, your name again?
Nazirah Hasnan.
Your age?
6.
46, eh? Okay. Your residency address is per IC, eh?
Okay, yeah.
What is your profession now?
I'm a rehabilitation physician and senior lecturer at the University of Malaya, Level Center.
University Malaya, eh?
Yeah.
Yes.
Okay.
Tuan, saya percaya rakan saya tidak bantah atas kualifikasi. Boleh rekodkan. Nazirah, you examine patient by Cik Sharifah Zuhairah binti Syed Tahir and proceeded to prepare a specialist report regarding the rehabilitation cost.
Yes, I did.
Saya pun rujuk saksi pada muka surat 34 hingga 48 ikatan B. Referring to page 34
Yes, I have it here.
to page 48 of your report.
Yes.
Can you confirm this is the report that you prepared for Cik Sharifah Zuhairah's rehabilitation?
Yes, it's my report.
Izin Tuan pun tanda sebagai
The page 34 to 48 just now. Page 34 hingga 48, eh? P2 tu.
saksi. Dan sekarang rujuk saksi pada muka surat 42 hingga 45.
Same bundle, eh? 40, 42.
45. Dr. Nazirah, you have basically given a quotation as to what are the cost items required by Sharifah. I just like you to peruse through your quotation. And are there any mistakes or any alterations you would like to do as to calculations or whatnot?
Thank you. It's actually not a quotation. It's actually an estimate of costs of the things that she'll require throughout her lifetime. When I was looking through the report again, I have noticed that I made an error in the mobility section, page number 13, item number 13, which item number 13, number 2, motorized wheelchair, which I've written that she might.
45 of the bundle.
Page 45 of the bundle, sorry. Motorized wheelchair, later in life, maybe 50 years and above. And I've estimated it as 15,000 ringgit for a motorized wheelchair with 5 yearly change, and I've calculated it at 150,000. So that's wrong. That was calculating it for 10 years, when in actual fact that I should calculate it for up to the estimated age of lifetime, which is 70 years in her case. So that should be 15,000 times 4, which is 60,000. These are all estimates. Yeah.
Okay. Dr. Nazirah, when you make such estimations, are you making these estimations based on someone who is actually unable to be mobile at all?
No. If you read my report in the bundle, which is from page 34 to 41, okay, and based on my comments, I have written clearly that she has the potential for modified independence in activities of daily living, wheelchair mobility, ambulation, and community integration in the future, but would require minimal assistance for some aspects of personal and home care because of poor hand function. She requires appropriate equipment and wheelchair accessible environment. So with that opinion, I went on to do the calculation of cost of equipments that she would require to enable her to have modified independence.
When was the exact date that you examined her?
I'll have to check. I think it was May. th of May, 2014.
Okay. At that time, when you analyzed her mobility, were you able to check according to the power of her grip or her legs?
Oh,
okay. At that time, what was the power of her, let's say, upper arm muscles?
Okay, sure. Of course, I have to do all that to come to the conclusion and the opinion that I gave. If you look at page number 46 in the bundle,
46.
okay, yeah. So the examination of Miss Sharifah Zuhira, because she's had a spinal cord injury, so the examination was done based on the International Standards for Neurological Classification of SCI, which is the Asia, American Spinal Injuries Association form, and this is the standard form that is used, standard examination technique that is used for all traumatic spinal cord injury cases in the world. If you are to publish papers on spinal cord injury, this is what you need to use. And in this form, if you look at it...
yeah, please guide us to where to look.
Okay. So you've got the diagram in front of you?
Yes,
okay,
page 46.
Yeah, if you look on the left-hand side, okay, so this form, this is the latest form from Asia. So it has divided the form, the body, to the left and right, if you notice. So on the extreme right, there are columns which was for elbow flexors, wrist extensors, elbow extensors, finger flexors, finger adductors, and these are the motor or key muscles examination. Okay, and if you notice, I have put in C5, which is the elbow flexors, at grade 5, which is a normal motor power. The wrist extensors, which is C6, was a grade 2. A grade 2 is is that the patient was able to move the wrist, extend the wrist, but not against gravity. Elbow extensors is again not two, which is not against gravity. Finger flexors 2, finger abductors 2. So that's on the right. On the left, she's got better power, which was 5 for the elbow flexors and grade 3 against gravity for the rest. And for the lower limbs, you look below. So the motor or key muscles that were tested were the hip flexors, knee extensors, ankle dorsiflexors, long toe extensors, and ankle plantar flexors. Again, the left was stronger than the right. If you look at the right, she had great power of grade 2 in the hips and the ankle, grade 3 in the big toe, and also the grade 2 in the ankles. However, on the left, she's got quite good power, which was 4 generally.
Yes.
Yeah.
And when you say left or right, in a sense that now our right-hand side is actually the left column. Well, I mean, if we are looking at the...
Yeah, but well, this is referring to the form,
Yes.
and it has divided the body to left and right. Yeah.
I just want to make it clear.
Because
when you
this
say
is-
left and right, it
Yeah.
means according
What's
to
written?
this
What's written on the
here,
form?
left. Okay.
And this is based on how you would look at the person. If you look at the person in front of you, right and left would be that way.
Alright.
Yeah.
Okay. Based on looking at the person face to face. Okay, fine. Okay. Dr. Nazirah, what we observe in the right-hand side, that means right sensory in your report.
Yep.
When I say right side, right report, we noticed that at that time in May, it was mostly 222 on the right hand, except the elbow was 5.
Yeah.
All the others, wrist, elbow, finger abductors, all 2.
Yep.
And then on the leg, on the right leg, it's mostly 3, 2, 3, and 2. Okay? That's correct.
Yeah.
Hip flexor, you put that 3, knee extensors, 3, and then ankle.
It's not very
2.
clear in this copy. It's not very clear in this copy, and I can remember the details. Yeah.
Okay. Now, your advice was based on the power at that point. Dr. Nazirah, how would it differ today if all of it, that means the elbow flexor, all that from top to bottom, all are 4 to 4 plus? You see? Because we found out from the latest report, she has already improved to 4 plus, 4 plus for most of her muscle power. Okay, I will show you that report by Dr. Kantha. Okay, Tuan Hakim, saya merujuk kepada P1. I don't have a copy, but the muscle power here.
Sure.
Now, with that report, and I believe Dr. Kantha is also part of the training staff in University Malaya as well, or you don't know him?
I was away for 4 years, when I was doing my PhD. So there are people that I don't know. Yeah, and it is quite a big hospital.
Fine. Right now, when you look at that report, and it is very current, I also received it just yesterday. Okay? So would you fill these boxes differently today, based on that?
Not unless I examine the patient.
Right. So, but if on that day it was 4, 4, 4, 4, 4, would your report at the back have changed? Would you change it if it's all 4 and the other side also all 4?
4 does not mean normal. 4 would still mean there's neurological deficit.
Yes. My
Yes.
question is, would you change the things, the requirement of lifetime lifetime
some,
requirement?
maybe for some aspects, like she probably will not need a lightweight wheelchair. That she'll probably be able
She
to.
would not need a.
She probably would not need a lightweight wheelchair. She'll probably be able to walk with modified with walking frame and things like that. Maybe. However, as I said, I will not change it unless I examine the patient. And I'd like to bring attention to the assessment that was done here, and also my assessment, whereby the patient has got spasticity and spasms. So in layman's terms, spasticity and spasm will be kejang, keras, okay? And with spasticity and spasm, it can mask the assessment of motor power in upper limbs and also lower limbs. So sometimes muscles can be seen to be stronger than what it seems because the spasm and spasticity has set in. So this was something that I observed, and I believe this was observed by the person who did this report as well. Yeah, so
Actually,
I will take...
My main question is that that person, when you saw in May, have a different mobility than the new report. Wouldn't it be? Wouldn't it be that there's a difference?
Perhaps it's
Yes
when you
or no?
talk about it's very difficult to give a black and white answer, a straight answer, because when you talk about mobility, it's not just about the motor power that you require. And when we walk, what we need is we need to be conscious that we are walking. Our brain needs to know that we are walking, and we need to have the intention to walk, and you need to have your muscles to be strong for you to walk. You need your sensation to be intact so that your feet will know where it's standing on, where it's stepping. And also, there are other things that affects walking, such as the balance, and also things like spasticity and spasm. There are many articles, evidence available that all these factors will affect walking. So
Yes.
if I don't examine the patient, I will not be able to comment on how she would be able to walk now with a so-called grade motor power of grade 4 to 4 plus, because I would like to assess to see if the spasm or spasticity has set in and has affected the assessment. And I think in this report it's clearly written so.
Which
Yeah.
report you're saying?
There's the new report that you've given me. Okay, if you look at page 4 of this report, and you look under, which is under opinion. Okay, what Dr. Kantha has written is that she also complains of muscular spasms. On examination, she has increased in tone over both the upper and lower limbs, with exaggeration of both biceps jerk and knee jerks on both sides. The plantars were upgoing bilaterally. These are clinical signs to diagnose an upper motor neuron lesion, which is secondary to the insult, blah, 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 blah. Full stop. While examining her right leg went into spasm after I told her to take a few steps with assistance. There's no doubt on the spasm, as well as jerky movements of the limbs during my examination. So it will be definitely, if spasticity and spasms are present, it will affect the motor power assessment. And this is, we can speak to any neurologists or neurosurgeons or rehab physicians. This is a well-known fact.
Okay. Right now, that means you are unable to confirm whether what you wrote in the May would apply to this patient now or in another 3 months, correct? It wouldn't apply because there are changes. Would you agree to that? You have to examine her right now to know the situation right now, because it has changed from 2 to 4. From May to now, it has changed, correct? So the things that you wrote during the May report may not apply to her now and may not apply to her in the same severity, in the same requirement, in another 3 months or 4 months, you wouldn't know.
From now, are you saying?
Yes.
I'm not too sure about that because
Wait.
I think about now
My
she's
question
probably about
again,
2
my
years.
question again.
Yeah.
Okay. I'm not asking you what will happen to her in future. I'm asking you that report which you wrote in May would not apply to her now or in another 3 or 4 months' time because the circumstances have changed. Correct? We cannot apply what you written in May wholesale now because it is not her current situation now. Would you agree to that?
Cannot agree to something that I've not examined her now.
Yes.
Yeah.
That's what my question is.
Yeah.
We cannot apply what you wrote in May to this person now who has recovered substantially to 4 plus, from 2 plus, from 2 to 4. Okay? We cannot apply what you said then to a situation now. That's what my question is. We cannot apply what you said then to a situation now. Correct?
You're forcing me to agree with you. If theoretically, yes, I suppose I have to agree with you. However, as I've said,
Step by step. I'll ask you later.
yeah.
Okay. Can you explain what is level 2 for us to understand? When you said the power of the muscle 2 as compared to, let's say, 1, can you explain again?
Okay, when muscles are assessed for power, we use the Medical Research Council scale or the MRC scale, and this power is graded between 0 to 5. 0 is when there is no power at all. 1 is when there is a flicker of contraction felt in the muscle examined. To make it easier, I can show if you want to examine your biceps, which is the elbow flexion. So, for instance, someone can only, if I ask the person to try to move your biceps and the person can just do that, so that's just a flicker of contraction, that's a power of grade 1. So if the person can move throughout the range, in full range, but without being able to do it against gravity, so that's grade 2. If the person is able to do it against gravity, so this is against gravity, so that's a grade 3. If the person can do it against resistance, grade 4. If the person can do it against resistance normally, that's a grade 5.
Okay. So 3 is gravity.
Against gravity.
And 4 is resistance. Okay. That means 3 means you can carry your hand up like that, but 4 means you put something there also that person can carry a bit.
Not necessarily.
Resistance.
Not necessarily.
Resist
Some
her.
resistance.
Okay.
With some resistance.
So would you agree to me that in May, when most of her right hand and right leg was just even below 3, that means not even against gravity, and now to 4, where she can resist resistance, that is a big improvement, isn't it?
As I've
In a
said,
few months' time, that is a big improvement.
as I've said, the motor power can be masked by the presence of spasticity and spasms. I've seen cases where a motor power of just grade 2 or even 1, when spasticity is full-blown, you can it can be held in rigid extension, and you would think that the patient is able to have full motor power. So, yeah.
So
it's-
you actually need to assess her now, correct?
to ascertain these findings.
Yes.
Yeah.
You need to know her situation now because it has changed, correct?
Okay. Another.
No, I'm asking you, in order to make another report which is more accurate, you need to examine her now, correct? It is changed.
It has changed based on
Yes.
someone else's report.
Yes, correct.
Yeah.
But if it is at 4 now, if you need to check her now because she is at 4, it would drastically differ from your earlier report in May because it's only 2. She can't even lift against gravity at that time. Correct?
Okay. But
No,
let
when you
me
say correct, is it correct or not? What I said, is it correct? Or not?
correct if I make
Okay.
if I make the assessment. But I would also like to tell you that I'm a rehabilitation physician, and my training is based on management of people with disabilities. And one of our core areas is to enable functions in people. And our assessments are always based on the functional outcomes of our patients. And our assessments are usually different from the orthopedic surgeon's assessment and also the neurologist and neurosurgeon's assessment, because we take into account things such as anti-gravity very, very seriously. So if you were to ask an orthopedic surgeon to examine a patient, even if the patient does that, he'll say, oh yeah, that's a 3. When, for me, that's not a 3. A 3 is only if the patient can do this. Or I've seen patients, I've seen other specialists doing, oh yeah, that's a 4. But the patient can't even do against gravity. So it's not even a 3. So again,
Are you doubting what Dr. Kantha has written?
I'm not doubting. It's just that we assess patients differently, and we take into account the functional aspect, and also we take very seriously things like anti-gravity muscles. And it's because we prognosticate functions, we prognosticate outcomes based on our power examination. So it's very important to do it very thoroughly.
Did you write in your report that she would need medication or things to heal her bed sore?
What I've written was she's at risk of developing pressure ulcers. That would be under skin. So under skin, which is in page 42 of the bundle, number 2. So I've put here risk of developing pressure ulcers and pressure ulcer related complications. And pressure ulcer related complications are things like sepsis, things like osteomyelitis, bone infections. And I've written here that she developed a sacral pressure ulcer during the first hospital admission. And what I have written here is preventive measures and treatment to prevent pressure ulcers, which is through education and pressure relief strategies, which includes support surfaces such as a ripple mattress and appropriate wheelchair cushion.
Yes.
Yeah.
Dr. Nazirah, we know now that she is able to shower herself. Okay, we know now that she can shower herself. Based on that knowledge, based on the knowledge that she can feed herself and she can shower herself, what are the possibilities that this person, barring falling again and all that, we are not saying all this speculation, based on a person showering herself, feeding herself, cleaning herself, what are the chances of her getting a bed sore a pressure sore?
It's not a bed sore because a bed sore is not correct because people don't develop pressure ulcers by just being in the bed. People can develop pressure ulcers from sitting in the wheelchair, and that's why the correct term is pressure ulcers. And by the way, the 20th of November 2014 is Worldwide Stop Pressure Ulcers Day, just for you to know. But anyway, with pressure ulcers, as long as a person has got impaired sensation, meaning that the person does not have full awareness of pain sensation, which is the case for Sharifah Zuhira. I can't remember whether it's the right or left in this case. I think, yeah, sorry, excuse me. On the left, she's got impaired sensation, so she is still at risk of developing pressure ulcers when she is sitting down. So that is why she needs appropriate wheelchair cushion. And when I assessed her, she had problems with hopelessness. She had low moods, and she wasn't moving around very much. Right. So that puts her at risk, and that's why she needs a ripple mattress. And she is a very bony girl. She's very thin. She's very bony, and that puts her at risk of developing pressure ulcers as well.
Yes. At that time, when you were assessing her, did you know that she was able to take her own shower and she was able to eat on her own?
I've asked history because that's what we do.
At that time?
And yes, at that time, yeah. And based on, if you look at page 39 in the bundle, which is the functional assessment, and this was based on the history that I took. Okay, you look at page 35 and page 39. So showering and eating, that's considered personal activities of daily living. And on page 35, based on what I got from her and her mother, she still required partial assistance in PADLs and either toileting, etc. She was able to feed herself, but she needs set up. Because, you know, when you eat, say you use fork and spoon when you eat, and you've got your rice and you've got your chicken, it's easy to eat. You can scoop and you can feed, but to cut, she needed assistance.
Yes, my question is this. At that time, you didn't know that she is able to shower herself, right? Because you put here the score is 1/3.
Yeah, she needed assistance.
Right.
Right now, 1/3 is she needed assistance.
From our information and from the doctor's latest report, she is able to shower and clean herself, right? So my question is based on that. My question is,
if you've got a power of grade 2, I will able to train you to shower yourself. That's my answer.
no,
If
right now,
you look,
you see,
listen. If
my
you
question is this: when we now know that she said she's able to shower herself and eat herself, would it not change the situation where you said that she's at risk of pressure sores? Because when she's showering, she can see whether she has pressure sores or not.
I'm so sorry. There's no connection between showering and pressure ulcers other than maintaining hygiene.
Yes, but your eyes can see that whether you are developing the symptoms of pressure sores, you know, or when you're sitting, you can touch and feel. Right?
That's part of the education. So if you look at what I've written, there's education there. So we educate our patients on how to check for pressure ulcers. So if I have a patient with risk of pressure ulcers, the number one thing that we do is to educate the patients on how and why they can develop pressure ulcers, and we educate them to do pressure relief strategies. We educate them to maintain hygiene. We educate them to moisturize the skin so that the skin is not too dry and prone to breakdowns. And we educate them on how to check for skin at the pressure sites. on the sites that are at risk of pressure ulcers once a day, and for the sites that they are not able to see, such as their buttock, we teach them how to use a mirror. So, yes, so...
After all this education, and you still say she needs a lifetime estimated cost of 17,000 and 28,000 ringgit. You know, this person is able to shower, eat, clean herself, watch herself, right? Why would she be categorized at a risk of developing pressure ulcers?
Because when she sits on a wheelchair, after she showers, it's a risk. And what I've suggested is to prevent the occurrence of pressure ulcers.
Yes.
Just like you wear a seatbelt to prevent yourself from getting thrown out of the car if in the event of an accident. So this is a prevention strategy.
Okay, thank you. So it's a prevention, and
and
there is a risk which you don't know the percentage of that risk. There is a risk.
There is always a risk.
90% or 50%.
There is always a risk. However minimal the risk, prevention is better than cure, because the cost of treating pressure ulcers and the complications of pressure ulcers is tremendous. You would do everything possible to prevent pressure ulcers. Okay? I've seen people dying from pressure ulcers, so I will not take chances with pressure ulcers.
Okay.
And coming back to what you were saying about she can now shower herself. So if you look at my report, under issues, page 37, under current issues, I listed pain, I have listed unsuitable equipment, and I've written here potential for wheelchair independence not developed, potential for safe short distance walking not developed, potential for independence in ADL not developed. So based on this report, what I felt was she needed a good rehabilitation program so that she would develop this potential. So with a good rehab program and with good practice, she would be able to develop all those activities.
Okay, Dr. Nazirah, what is the meaning of neurogenic bladder?
Neurogenic bladder is when a bladder function is affected by a neurological condition. So hence the taste.
That means she cannot go to short toilet, meaning that cannot kencing.
Cannot kencing is more like a urinary retention.
Oh, this one is?
Yeah, and urinary retention can happen due to many reasons. It can be obstruction, or it can be neurogenic, meaning that for you to pass urine, what you need to do is the body needs to know that the bladder is full. The body needs to know that it's socially acceptable to go to pass urine, meaning that you have to go and look for a toilet and something which is socially acceptable, and then the bladder needs to contract. Okay, the bladder is like that, and you have your urethra, and you have the urethral opening. So the bladder needs to contract, and within the urethra, there are two sphincters. So the sphincters need to open up to allow the urine to come out. So how this is coordinated is from the brain and the spinal cord. So the nerves will all go to the bladder.
I refer you now
yeah.
to Dr. Kantha's report. Okay, can you, because you're a doctor, can you look at the page where he mentioned about urine, about bladder control? What did Dr. Kantha say about?
As for her bladder, she has good control.
Yeah.
However, there have been times where she has wet her bed as she is unable to control her bladder, which was also what I observed in my report. If you look at my report, page 36 in the bundle, what I've written there is she's able to fill a full bladder, able to void spontaneously, but has urgency and frequency. Urgency means cannot tahan. Frequency means too often lah. Frequency, sometimes even every half hourly. She has had a urodynamic study, which is study which we look at to see the activity in the bladder, but the report is unavailable, so I wasn't able to report to comment on that. So based on this history that I got, I said that it is likely that she has an overactive or a hyperreflexic bladder, which is one of the features of a upper neuron bladder, of a neurogenic bladder.
Yes. But you see, in your report, your estimated cost, you put that risk of urinary tract infection.
Yeah.
Wouldn't all of us have a risk of urinary tract infection?
Not as high.
How would she differ from us?
We do not have much risk of developing urinary tract infection unless our hygiene practices are not very good, or we have other problems, or we have other problems in urinary tract. With a patient with spinal cord injury, even in incomplete spinal cord injury, with a neurogenic bladder, what can happen with a neurogenic bladder is, because the emptying may not be complete. Okay, as I've said, I don't have the urodynamic study, but I can, from my experience and from the literature, in a neurogenic bladder, what can happen is there'll be problems with incomplete emptying because the bladder is unable to contract strongly and the sphincter doesn't open up.
She doesn't have this problem right now, correct?
But she has got urgency and frequency. She has got urgency and frequency, and every half an hour. And when I took the history, even every half an hour, and so there is a chance that she may have a lot of retention in the urine, and with retention of the urine in the bladder, it puts a person more susceptible to getting infections in the bladder. And the problems with bladder and UTI is that a UTI in the bladder can lead to things like sepsis. A UTI in the bladder can lead to things like abscesses in the kidneys. And recurrent UTIs can cause a lot of other problems.
Doctor, yes.
Yeah. And I think in my calculations, which is number 3, what I've given here is risk of infections, calculi, hydronephrosis, and renal failure. And I advocated education, vitamins, and annual investigations.
Yes,
yep.
Thank you, Doctor. Doctor, I refer you to page 44 and number 8. You have said that, there might be related complications like diabetes, hyperlipidemia, hypercalcemia.
Yes.
Did you check whether the patient was diabetic?
She's not diabetic. Well, from history, she's not, but endocrine and metabolic related complications,
She
which
is
means
not diabetic, correct?
No,
Okay.
of course she's not diabetic. But in this report, endocrine and metabolic related complications I've written there is because she is at risk of developing diabetes, hyperlipidemia in the long run. It has been shown, there is evidence, there's research evidence. In fact, my PhD was on exercise and health promotion for people with spinal cord injury, and I did extensive reviews on the incidence of diabetes.
2 million people out of the 30 million people in Malaysia is diabetic.
Yeah. Okay.
So there is quite, you would say that this is speculative and doesn't apply to her only. It applies to a lot of people, And we have the highest rate. This is a very speculative thing to say that, if she developed diabetes, then she would need this.
No, actually, it's not that she developed.
No report here to say that this person, due to this thing, will develop diabetes. Therefore,
I beg to differ. There are a lot of evidence which shows that people with immobility-related conditions, people who are less active than others, are at risk of developing complications such as diabetes and hyperlipidemia. And with this patient, she is at risk because she has got problems of reduced activity because of a condition. So she is at risk. And what I've written here is prevention strategies, which are exercises and physical activity. And this is not as a treatment for diabetes. This is for prevention. The heading here is preventive measures and treatment, and appropriate diet, and annual blood investigations to monitor this. And this is what we practice in our clinic setup, that with all the spinal cord injury patients that come in to us, and those with chronic limitations in mobility, we do these check-ups because they are at risk.
To the person you saw in May 2014. Thank you very much. Itu saja soalan-soalan saya. Terima kasih.
Earlier you referred to Dr.Kantha's report.
Yeah.
May I refer to his report also? Can I refer to that big bundle
Okay.
at page 52? Last paragraph. Can you just have a glance or read of the last paragraph
Okay.
where he states that she will require assistance in her daily living for most things. She is able to feed herself but not cook. She will able to bathe with shower but not walk to the shower. She's able to walk but with assistance. All of these points do depending on assistance from time to time of the alleged accident. Based on this latest report, last paragraph, is it necessary for you to actually examine Sharifah Zuhairah again?
I don't think I need to examine her again. The report which I did in May, I think was comprehensive enough. And as I've said, the costs are estimates of what she would require throughout her lifespan.
And Dr. Kantha has also said that there's not much changes since the time from June till today.
Yep.
So, are there any changes? The plaintiff is present here. I mean, do you actually need to, would your report differ in any way or whatsoever?
I don't think so. She's having a spasm now, actually, I think.
She's having spasm.
The right lower limb is having a spasm, as you can see that it's sticking out. Yeah, no.
So, why did you actually tell Mr. Vincent just now that you would have to examine her again?
If he is, because he was badgering me about this 4 and 4 plus assessment, and I've said that motor power assessments can be masked by the presence of spasms and spasticity. So motor power, which could be lower than this, could be seen as a 4 because of spasticity. So if I were to confirm this, I would examine her, but that is just to examine the motor power. But other than that, based on the functional assessment, because as you know, we do not just assess the patients on the neurological findings, but we assess the functional findings as well. So this has been done by myself, this has been done by Dr. Kantha, and I think we are pretty consistent there. Terima kasih, Aldi.
Suhaimi, tapi data saya setuju dengan laporan muka surat 3 dan 4 berkaitan B.
Ya, Tuan. Kerana ialah initial report.
Muka surat 3 dan 4 berkaitan
Gabungan tu, B.
gabungan.
Kaitan B tu.
Ya. Dan ada satu lagi initial report daripada hospital Ceras. Muka surat 21 dan hingga 24. Ini juga ada satu laporan awal dari pihak rehabilitasi hospital Ceras. Saya bahkan saya tidak akan insyaAllah.
Ya, Tuan. Kita, ya.
One by one. Okay, muka surat 3 dan 4. P3 kan? Okay, next tadi you refer.
Next adalah
Muka surat
21 hingga 24 Tuan.
P4 kan? Next page.
Itu saja setakat ni dua.
Yalah. So P3 dan P4. Four to 48. P2 kan?
P2 Tuan.
34 to 48. P2. Plaintiff ketiga dipanggil. Yes, oh doctor.
I, Ramnan Jeyasingam, do solemnly, sincerely, and truly declare and affirm that the evidence which I shall give in this case shall be the truth, the whole truth, and nothing but the truth.
Name again.
Ramnan, anak lelaki, Jeyasingam.
Okay, umur.
44 years, Tuan.
Okay, alamat seperti kad pengenalan
Yes, Tuan.
Okay, profession anda sekarang
Medical doctor at Columbia, Asia,
Columbia Asia kan?
Extended Care Hospital, Shah Alam.
Dr. Did you prepare medical report after examining Cik Sharifah Zuhira binti Said Tahir in her house?
Yes, I have.
Saya buat beberapa saksi pada muka surat 5 hingga muka surat 16. Is this the report, page 5 to
Yes, this is my report, Tuan.
oh, ditanda sebagai exhibit
Muka surat
5 hingga muka surat 16.
P5 kan? 5 hingga 16 bandel B
Doctor, are you a rehabilitation physician or specialist?
I do not possess any specialist qualification. Yes, Tuan.
Dr. Ramnan, when did you examine this patient?
I examined her on 31st of July 2013.
31st July 2013. Okay. That is now 1 year, 3 months. Correct.
1 year, 4 months, 1 year, 3 months.
Yeah. About 1 year, 3 to 4 months.
Yes.
Columbia Asia is in the business of rehabilitating people or giving nursing care as a business in Shah Alam, correct?
Yes, we are a business entity.
You have said earlier that you are not a specialist, whether it is neurology or orthopedics, correct?
Yes, I am not a specialist.
Would you not agree that if a patient stay longer in your hospital would benefit as a business for his nursing care, correct?
Yeah,
The longer it is, the more profit for the Columbia Asia, correct?
Yes, that is true.
Yeah. Now I can see that there are pictures taken by you regarding the patient, and that was 1 year plus ago. Did you know that at that time she can shower herself and feed herself? Did you know that?
Not independently, but she could participate in the action.
At that time when you went to her house,
Yes.
did you know that she can shower herself?
I disagree.
Sorry?
I disagree with that. She still needed help from her mother.
At that time, she still needed
Help from
help
her
from
mother.
her mother to clean herself. At that time, correct?
Yes, that is correct.
At that time when you saw her, how did the mother bathe her? Was it a pail?
No, she was made to sit on a plastic chair and then showered by the mother
Shower means what?
with a pail.
With a pail, correct?
Correct.
We would say bathed by her mother. We are not exactly using that shower thing, right? It's
Yes.
bathed by her mother,
Yes,
correct?
that is a reasonable way to say.
Okey, Tuan Hakim, itu saja soalan-soalan saya. Terima kasih.
Thank you, Tuan.
Saksi plaintiff keempat.
Bawa saya, Sajian 126456, Asyari bin Madahal. Dengan sungguhnya dan suci hati mengaku dan berikrar bahawa segala keterangan yang akan saya berikan dalam perbicaraan ini adalah benar, tidaklah apa-apa yang tidak benar melainkan benar belaka.
Nama sekali lagi, nombor badan.
Asyari bin Madahal, nombor badan 126456,
Berumur.
43 tahun.
Bertugas di mana sebagai apa?
Cawangan Trafik Kuala Lumpur sebagai penolong pegawai penyiasat.
Cawangan Trafik Kuala Lumpur, penolong pegawai penyiasat.
Terima kasih, Arif.
Sarjan Ash'ari. A.S.H. Holland. A.R.I.
Okey.
Pada 14 Disember tahun 2012, di mana kamu bekerja dan jawatan ini?
Saya sedang bertugas di cawangan trafik Kuala Lumpur sebagai penolong pegawai penyiasat.
Pada hari tersebut ada siasat satu kes kebalangan jalan raya sampul report number 104-096-2012.
Ya, ada.
Aku duduk saksi pada muka surat 60. Duduk pada muka surat 60. Ikatan B. Ghani Raja Kasar.
Ya, betul.
Pun ditanda sebagai eksebit, Tuan.
Muka surat 60. Ikatan B P6 tu. P6.
Berdasarkan siasatan arah perjalanan motor lori BJT 9347 dan motosikal yang terlibat WWK 9107 sebelum kejadian arah perjalanan.
Arah perjalanan daripada atas ke bawah. Ya, kedua-dua.
Apakah kerosakan yang dialami oleh kedua-dua kenderaan itu?
Motor lori di bahagian tangki minyak dan motosikal di bahagian exhaust sebelah kanan. Exhaust kanan, yang Arif. Di tangki minyak di sebelah tengah.
Tangki minyak di sebelah mana?
Tangki
Kiri
minyak,
atau kanan?
tangki minyak kiri.
Kiri.
Ya.
Ini Tuan, saya pun duduk saksi pada muka surat 62, 63, 60 hingga 65, Tuan. 62 hingga 65. Mereka ini gambar-gambar
Ya, betul.
kerosakan pada
Ya, betul.
dan muka surat 62 tangki minyak yang dinyatakan di sini.
Ya, betul.
Aku tanda sebagai eksebit.
Ya, betul.
62 hingga 65.
62 hingga 65 tuan. P7 tuan. Itu Japan.
G. Ghana.
Ghana.
7.
G ya.
G.
P7. P7 A hingga G. 7 keping gambar. Am I right, Mr. Surya? 7 keping.
Apakah keputusan kes ini?
Keputusan kes yang telah dibuat, kesalahan kepada motor lori di bawah Rule 71 LN 166 Palang 59.
271. Adakah saman ini telah dijelaskan oleh pemandu motor lori?
Ya, saman telah dijelaskan oleh pemandu lori tersebut.
Mengapa saman telah dikeluarkan ke atas motor lori tersebut? Jika dirujuk pada Raja Kasar.
R7 bracket 1. Ya, Tuan. Kesalahan tidak rapat ke kiri jalan, Tuan.
Kiri je.
betul.
Pemandu kereta sama di bawah
Mengikut siasatan, motor trailer berada di lorong kanan dan ubah haluan ke lorong kiri untuk masuk ke simpang kiri.
Sekarang saya rujuk saksi pada muka surat 58. Okay. Nanti boleh kesakan ini adalah laporan oleh penunggang motosikal yang terlibat.
Ya, betul.
Sorry, I got the wrong page. Sorry, surat 59.
59, ya. Muhammad Nazrin.
Sorry.
Penunggang.
Anda not tendering.
Not really.
Okey, Sergeant.
Ya, tak.
Dalam gambar rajah kasar yang kamu lukis pada muka surat 60 iaitu P6,
Ya.
60.
ya. Jalan itu satu hala sahaja.
Ya, betul.
Ha?
Ya, betul.
Awak tidak berada di tempat kemalangan semasa ia berlaku, betul?
Ya, betul.
Adakah apa-apa kesan seperti brek atau pecahan kaca di atas jalan yang menunjukkan lori menggunakan jalan kanan? Ada tak kesan dia?
Tidak ada.
Okey, sekarang mengenai lori itu. Lori itu ada dua bahagian jenis ini, kepala boleh pusing punya, betul?
Betul.
Berapa roda semuanya dalam lori jenis ini? Kepala dan badan dia.
Oh, saya tidak pasti.
Tangki minyak. Boleh kamu tunjukkan kepada Tuan Hakim sebenarnya di mana bahagian tangki minyak yang segi empat tu yang mana kena?
Tangki minyak.
Aha.
Di mana sini? 62. 62.
Pada gambar motor lori ke?
Bagian X ni lah.
X.
See, we just have to see then I mark. Where? Oh, there. Not up here. Oh,
Betul
okay.
tak?
Bukan
Ya,
yang
betul.
putih tu.
Ya.
Okay.
Ya.
Peluang tadi.
Ya, kan.
bahagian putih-putih tu atas. Bukan?
Ini tangki minyak lah bahagian ni.
Oh bukan, saya tanya mana kena. Kena sana lah, tapi
Ini lah.
okey tak apalah.
Kena rosak ke?
Ya kan?
Ada tanda di situ.
Tidak, tanda tidak terlalu, cuma tidak terlalu jelas.
Okey. Tangki minyak ni hanya ada di belakang kepala lori kan, bukan di hujung lori kan. Dia belakang kepala lori,
ya,
betul?
Betul.
Okey, adakah betul jenis lori ni kepala perlu pusing dulu baru badan ikut kerana dia dua bahagian, betul tak?
Betul.
Berapa jauh dari depan lori tangki minyak ini? 10 kaki, 15 kaki, 4 kaki, berapa kaki?
Saya tak pasti.
Cuba kita lihat motosikal ni. Okey, motosikal ni jenis apa, berapa cc? Awak ada siasat tak?
Saya siasat punca kemalangan dan jenis serta yang lain-lain saya tidak pastilah.
Adakah awak tahu atau dari siasatan lain-lain awak nampak motosikal ni lebih daripada 100 cc tak?
Lebih pada 100 cc.
Ha?
Lebih pada 100 cc. Jenis Yamaha 135.
Jadi dia 135 cc lah. Betul?
Ya.
Dalam siasatan awak pada hari itu, kedua-dua mereka pergi mana?
Daripada catatan saya, pengadu pertama datang buat report dan dia mengatakan dia melalui Jalan Gombak untuk ke Jalan Suria. Untuk ke Jalan Suria.
Oh, bukan. Untuk pergi bekerja?
Dia tak ada cakap untuk bekerja.
Ke Jalan Suria.
Ya.
Selain daripada percakapan saksi-saksi, kamu tidak ada apa-apa bukti fizikal di atas jalan menunjukkan lori menggunakan jalan kanan, betul?
Ya, betul.
Berapa tan lori ini?
Saya tidak pasti berapa tan.
Daripada siasatan kamu, motosikal ni hanya rosak di exhaust pipe.
Ada lagi rosaknya di bahagian cover set, handle.
Semua cala, betul?
Ya, betul.
Dan kamu tidak tahu sama ada dia berlanggar atau kerana dia menggesek atas jalan selepas jatuh. Kamu tak tahu cala-cala itu macam mana berlaku.
Saya tak pasti.
Jadi kamu tak tahu sama ada dia gesek macam ni atau dia terjatuh kemudian gesek atas jalan.
Mengikut pada pengakuan daripada Muhammad Nazrin, motor sedang berhenti dan kereta lori membelok. Lalu motor sedang berhenti dan lori membelok terkena kepada motor.
Mengikut cakap dia, motor dah berhenti, lori datang masuk macam ini.
Ya, betul. Betul.
Kalau macam itu, lori sudah nampak dia dari mula.
Lori besar dia tak nampak, dia tinggi.
Awak tak tanya dia kenapa berhenti di tengah jalan?
Dia nampak lori di sebelah kanan, kemudian dia cuba berhenti. Bila dia berhenti, lori tetap juga belok. Sebab dia ada ruang di sebelah kiri untuk lalu. Motor ada ruang untuk masuk.
Ya, kenapa dia berhenti? Awak ada tanya dia tak?
Sebab dia nampak lori tu nak berbelok ke kanan, berbelok ke kiri. Kalau dia terus, tak boleh lah. Dia kena berhenti.
Dia nampak. Tuan, itu saja soalan-soalan saya, Tuan. Terima kasih.
Satu soalan saja. Tadi saya cakap, menurut percakapan dia nak pergi ke Jalan Suria. Siapa tu yang nak pergi?
Lori.
Lori.
Ya.
Itu saja.
Oh, tadi saya tanya soalan ke mana mereka nak pergi. Soalan saya tidak tahu, awak tidak faham. Saya tanya ke mana penunggang dan saya kata kedua-duanya. Erti plaintiff dan penunggang, mana mereka pergi?
Kalau pemandu lori untuk ke Jalan Suria, yang pemandu motosikal saya tak pasti.
Awak tak tahu sama ada mereka sedang pergi mana?
Saya tak
Dia bawa pembonceng tu.
Saya tak tahu.
Dia ada
Terima kasih, Arif.
Test case got